In the other extreme of life, there is no contraindication for yoga practice. Yoga practice can be continued up to any age, and rather I would say yoga practice can be newly started. You can teach yoga for an old person aging 80 years, 100 years or even 120 years. No problems. The only thing is, in the brackets, very important, consider the limitations of that whole individual. Individual limitations. For example, a person coming down to you to learn yoga at the age of 70 years, can he or she learn yoga? The answer is yes. But if he or she is suffering from high blood pressure, definitely you would not suggest inverted postures. Osteoporosis basically is the amount of calcium from the bones it reduces. There are small holes, the bones become porous. There are minute holes developing in the bones because of calcium deficiency. Whatever the reason behind it, because of the calcium deficiency, the calcium from the bones is actually extracted and it is brought in the blood to maintain the blood levels of calcium. So there is actually extraction of calcium from the bone leading to osteoporosis, the bones becoming brittle. What is the role of yoga? I would say yoga is the best solution for the condition of osteoporosis. Because in osteoporosis, the only solution is number one, calcium supplement, and number two, physical activity. Even the orthopedic physician, orthopedic surgeons, they would suggest to increase the physical activity. Maybe going for the gyms, light weight work or bicycling or walking, something like that. So a physical activity plus the supply of calcium. These two things, they are important for the condition of osteoporosis. So the physical activity can be definitely improved with yoga practice. And also the advantage would be less of injuries. There would be less injuries because the person is going to do the movement slowly, steadily, and is going to maintain the position. So the chances of injuries in a bone which is already brittle, the chances of injuries, they are less with yoga practice. And at the same time, no doubt, calcium supplementation is to be continued. Yoga is, again I am saying, yoga is not a magic. It's a science. So you can't expect that the person is practicing yoga and overcomes the osteoporosis. It is not possible unless and until there is a proper calcium supplementation. Whether tablets, diet or whatever, but calcium supplementation is definitely needed. And I would say osteoporosis is not a contraindication for yoga practice. Definitely not a contraindication. Any person who is suffering from osteoporosis, I would suggest rather for him or her to practice yoga to overcome osteoporosis. Now talking about another aspect of bones is the joints. Because whenever we talk about the skeletal system, it is important that we talk about the joints. Just imagine if there is no joint in the body, what would happen? From top to bottom, one single bone. Practically nothing would be possible. Even I standing in front of you and going on blah blah blah, this joint is moving. So there needs to be some joints in our body for the basic function of the skeletal system, and that basic function is locomotion or movements. Any movements in our body, we need the joints. So this joint, this is just a brief idea of how the joints are formed in the bones. Now for joint formation, there needs to be minimum number of bones is 2. There can be more than 2 bones in one single joint. Very commonest example is our elbow joint. It has 3 bones in it. This is one single bone, the humerus, and there are 2 bones here, the radius and the ulna. Here in our forearm, we have 2 bones. Some of you might be knowing it or you might not be, but this joint, the elbow joint, is formed of 3 bones. So there can be many bones in one single joint, but for any joint formation, at least 2 bones are needed. Minimum 2 bones, more than 2 bones can also form the joint. Now these 2 bones, they never touch each other. There is always a gap. They are not precisely touching each other. There is a minute gap in between these 2 bones. And this gap, it is actually covered by a cartilage-like structure. a soft covering, we can say. It's a soft covering of a cartilage over the two bones. The white thing what you can see here. It's a soft covering of cartilage over the ends of the bone. Now these two bones, as I have said, they are never touching each other. There is always a gap, and this gap is filled up with a fluid, with a liquid, which is called as the synovial fluid. Synovial. A fluid, a sticky, oily liquid in the joint space. The function is lubrication. The function is to avoid friction whenever the joint is moving. So whenever you make the movements of the joint, this oil or this liquid, it would prevent friction, it would act as a lubricant. Each and every joint has this lubrication which would prevent friction, and obviously it would prevent the pain which may develop if the bones they are touching each other. So that is one thing. And another thing is the disc of cartilage. Here it has not been shown, but there is a small disc of cartilage in between the two bones, especially when the joint is a major joint. For example, the knee joint. In the knee joint, you would have a disc of cartilage between these two bones so that there is no friction. Again, the function is the same, to avoid friction between the two bones when the bones they are moving or when the joints they are moving. So the friction is avoided and lubrication is being provided by this oily fluid and the disc of cartilage in between the bones. And then all this structure, it is actually enclosed in a bag-like membrane or a bag-like structure. It's all enclosed. And this bag, you would call it as the synovial membrane. If you forget it, that's fine, no problem. Just remember, it's all enclosed. It is all covered in a bag-like structure. And then over this bag-like structure, you have the muscles and the ligaments outside this bag. So when we talk of the muscles and ligaments, they would be outside this synovial membrane. The muscles, the ligaments, the tendons, everything and anything related with the joint, it would be outside that bag-like structure, and then they would help the joint in the movement. There are two types of joints. One is the fixed joint, another is the mobile joint. The names themselves, they are suggestive. The fixed joints are the joints where the joint is present but there are no movements. Movements are not possible. The example is the skull joints, and even the vertebra is considered, or the backbone is also considered as a fixed joint. Why it is considered as a fixed joint, we'll just talk in a short while. But for the time being, the skull and the vertebra or the backbone, they are considered as fixed joint, no movement possible. On the other hand, the mobile joint, the movement is possible. These are the joints which are used for locomotion. These are the joints which are used for movements. There are four subtypes of this mobile joints. We'll just have the view of one example and we'll just keep it off. First is the ball and socket joint. The example which you can see here is the hip joint. Here actually there is a structure which would be like a socket with a ball in that. Another example is the shoulder joint. The advantage of this type of joint is rotation. You can rotate your shoulder, this particular action, the rotation of the shoulder. That's because of the ball and socket joint. Now, in our shoulder joint, the scapula and all the other bones, they form a socket. Say for example, in my right shoulder, this would be a socket here somewhere, or a cup-like structure. And in that, the bone, this humerus or the bone of my arm, it would be fixed in this. And the other end, it would be rounded, like a ball. So when I am doing this particular action, the ball is actually rotating in this cup-like structure. So this is the ball rotating in this cup-like structure. So the rotation movements, they would be possible in the ball and socket joint. Another type of joint is the hinge joint. The example here, it has been shown of the elbow joint. But the more significant, more important example would be the knee joint. Knee joint is a hinge joint where movement is possible only in one direction. If you want to move the knee, you can move it only in one direction. The movement of the knee in other direction is blocked. Similarly, the fingers. If you want to bend the fingers, this is the only action. You can't go the other way. Naturally, it is not possible. Hyper-flexible people, okay, sometimes they can do that. But naturally, this is the only movement, one direction. So that is the hinge joint. The other type of joint is the sliding joint. Other names for it is the gliding joint or plane joint. It's one and the same. Some books mention it as a gliding joint. Gliding, sliding or plane joint. It's one and the same. Here actually one bone is sliding over the other when you are making the movements. You are looking at the wrist joint here. So when you are doing this action, the movement of your wrist, this particular action, these two bones here, these two bones, they will remain steady, and this whole of your palm, it would be sliding over these two bones. So that's the sliding joint or the gliding joint, plane joint. The last one is the pivot joint. Now this pivot joint, it is a very unique joint present only in the first and second vertebra of the neck, or the first and second bone of our neck. The second bone in our neck, mind you, the second bone in our neck is something like this. The bone, this is the main part of the bone, and it has a projection upwards. This projection usually is called as a pivot. So there is a projection upwards for the second bone in our neck, and the first bone of the neck is placed over it like this. And of course above this first bone is the skull. So when you want to do this action, shoulder to shoulder action, or usually as I say, when I ask you whether I should continue the session, you go on doing this particular action. So this action is basically the pivotal joint. The second bone is fixed, and the first bone, it goes on rotating halfway. This particular action is the pivotal joint, where the second bone is firm, steady, and the first bone, it just rotates over this second bone. Now this backbone, it is not one single bone. There are actually 32 bones in our back. Plus or minus 1 and 2 here or there is okay. It's individual have that differentiation, but on an average, most of the individuals, they have 32 bones in the back. Now these 32 bones, they are placed one above the other, forming a chain-like structure, one bone above the other, total 32 from the neck up to the bottom of the coccyx, the last one which is called as the coccyx, or the bones below the lumbar region. Now this backbone or the vertebral column is never straight. As I said, it's a chain of multiple bones. These bones, they are not having a straight alignment. There are natural curves, there are natural bends in the vertebral column. So you are looking at this vertebral column from one side. If I stand facing towards that door in that direction, this would be my vertebral column. So in the neck region, the vertebral column is having slightly a forward bend. In the chest region or the thoracic region, it is having a slight backward bend. In the lumbar region, a forward bend, and below the lumbar region, a backward bend. So it's having 4 natural curves in our vertebral column. In the neck, bending forwards. In the thorax, bending backwards. In the lumbar region, again forwards, and below the lumbar region in a backward direction. So these are the 4 natural curves. Our vertebral column is never straight. And the significance of these 4 natural curves is to help in the balancing mechanism of our body. It helps to balance our body. Because human beings are the only individuals, they are the only animals on this planet who stand on 2 legs. And for that balancing mechanism, it is very important that we have these curvatures. Now, these curves, they are also related directly with the birth of the baby. A newborn infant, a newborn child, usually has a straight vertebral column, or rather the vertebral column, the backbone of the infant, newly born infant, is straight. The infants or the babies of other animals, if you have seen maybe a horse, a camel, a cow, immediately after birth, they would start walking, they would start jumping. Have you ever seen this with the human infant? Immediately after birth, the infant starts walking. It's not possible. It's not possible because of the vertebral column. What is the first most important precaution when you carry an infant in your lap? Very important thing which you do. You support the neck. One arm below the neck and the other arm holding the infant. The reason, if you don't support the neck of the infant, the neck would fall back or the head would fall back. After a few days, you don't need to support the neck. It is the natural way of balancing. So whenever you are learning or teaching yoga, the first positions would be the prone or the supine positions. The next positions which you would be learning would be the sitting positions, and then you would be learning the standing positions. On day one, no one teaches you the standing positions. At least we are talking of what we teach you. Because that's what goes with the natural way of balancing. Because when you are lying down on the back or the abdomen, prone or supine position, you don't need to take efforts to balance yourselves. You can balance yourselves naturally. When you are sitting, you need to take some efforts to balance yourselves. And when you are standing, it takes the maximum efforts to balance yourselves. And that is how actually you are learning to balance yourselves in your childhood. So the same way is practiced when you are going to learn yoga, prone and supine positions first, then the sitting positions, and next in the last you will be practicing the standing positions. Now that was related with the backbone, talking about the uses of the bones or uses of the joints in our day-to-day activities. We would say that we are actually utilizing our joints in three ways. If you classify the use of joints, utilization of joints, we are doing it in three ways. Number one is non-utilization of joints. We do not utilize the joint at all. Natural movement is possible, but we do not use that natural movement. Non-utilization of joints. Second is misusing the joints. We are using the joints, but in a wrong way. And third would be overusing the joints. We are using the joints, but we are using it too much, beyond the capacity. If we just try to understand them with one example of each, it would be easier. We start with overuse, for example. Overusing the joint. The example depends on the profession. If you talk about me, my example is always going on blah 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 blah. Overusing the jaw joint. Continuously going on speaking, I am overusing the joint. Continuously standing, I am overusing the knee joint. So depending on your own profession, the overuse of the joint would be different. Nowadays we talk about kids, and one survey statistical observation shows that the kids, they are using one joint very frequently or overusing one joint, and you must be aware of that, and that is this joint, the thumb joint. Anywhere and everywhere you need the thumb. The laptops and the cell phones and the video games, anywhere, the thumb joint is utilized the more. So depends on your profession, overuse of the joint. Yes? Most of the times we tend to put more weight on one leg. We would not stand straight. Ideally, you should be standing straight. The weight should be transferred equally to both the legs. 50% to the left, 50% to the right. But sometimes, or most of the times, you would tend to go on one side. Either you would put the weight on the left leg or the right leg. That is, I would say, misuse. Bending forward, that's very commonest misuse of joint. If something is lying down on the floor, how do you go for picking up the thing? You just bend in your back and try to pick up the thing. When ideally, it has been suggested that you should bend in the knees, go down and then lift up the thing. And the first thing what we talked of was non-utilization of joint. Non-utilization. Movement is possible, but we do not make use of that movement. Commonest example would be backward bends. Most of the times in the day-to-day activities, we bend forwards, but bending backwards is very less. Bending sideways is less. Rotation of the spine is very less. So the movement is possible, but still we do not perform that movement. And when we are utilizing the joints in these three different ways, misusing the joint, overusing the joint, or not utilizing the joint, at a physical level, I would say it would produce the stiffness and other things what we are always complaining of. Say for example, standing positions. If the person is standing for long, the immediate solution for that would be more focus is on inversions. It's not only with the joints, but it is also related with the blood circulation or the way the muscles they are used. Because the gravity acts only in one direction over the muscles. So if the muscles they are in an inverted posture, even the gravity acting over the muscles, it would be released. Say for example, if a person is continuously in a habit of bending backwards or bending forwards, that type of exercises or that type of yoga practice can be avoided for that particular individual. A continuous forward bending, say for example, if the person is working in some industry and working over a machine in this direction, in this position, it's producing a strain over the back, always bending forwards, it can be counteracted by bending backwards. So more importance can be given for this person for backward bends rather than forward bends, something like that. And one fine morning when you sit erect, the muscles they start complaining. For last 25 years you have been telling me that this is the right position. Now you are telling me that this is the right position. So number one, it has an effect on the muscles. Number two, if you just have a look at a closer look here, this is the vertebral column, the disc, and here you can see one small hole. Through this, the nerves they are coming out. So there would be compression of the nerves if the position is not proper. At whatever level, maybe the neck, the chest or the lower back, there can be the compression of the nerves. That is one problem which it can cause. Next thing is related with the breathing. Because ideally the movements of the diaphragm, they are designed, or the diaphragm is functioning to its maximum 100% capacity in erect posture. If you are in this particular posture, the movements of the diaphragm, they are restricted. So again, it would lead to breathing problems. Another thing, any abnormality or any bending or something sitting in that posture or whatever, it would produce a change in the space available inside the chest and inside the abdomen. The space which is available for the organs. In this, we say always the chest should be open. So when we are sitting something like this, there would be the space inside the chest available would be less. So the functioning of the heart and the lungs is compromised. At the same time, if you are bending like this, something like that, a pressure over the abdomen, the functioning of the abdominal organs, it would be compromised. So definitely for optimum functioning, because the anatomical structure of our body is designed in such a way that the organs can function optimum, especially the chest, the lungs and the heart in this particular position. If you are sitting like this or something like that, in closing your chest, it's going to definitely produce a pressure and a adverse effect on the functioning of the organs. Most of them.